Good day, everyone. Welcome to another episode of Campus Health Matters. I am Karima Yahya Titilokwe, your host, and today we are going to be talking about a very serious issue that affects us youths on campus: drug abuse. With the stress coming from lectures, assignments, and social life, it is an important issue that we ought to address. And we had an interview with Dr. Alex Otu, the Deputy Director of ABU Health Management Services. He gave us insights regarding this issue. Let's take a look at the video. Yes. Good afternoon, sir.
Good afternoon.
Thank you for having us.
Pleasure.
Sir, please, can we know your name?
I'm Dr. Otu Alex.
Okay. Thank you, sir.
Yeah.
We are going to be asking you a few questions about drug abuse and its effects concerning youth on campus. So the first question is, can you please tell us what is drug abuse briefly?
Okay. Drug abuse, as you know, is any misuse of medications. Like the name implies, it is an abuse, which means it is an abnormal use of medications, to put it simply to the layman. There are conventional drugs that are used for purposes of healing. There are drugs that are used for relieving pains, for example, or for curing illness. Every drug that are not used for the designed purpose for them is an abuse. An abuse can be using a medication for purposes different from the initial use, number one. It can also be that it is used in a way in dosages that are out of the normal dosage for use. It can also be, it is also an abuse if it is used for a prolonged period more than the specified for its use. So in summary, drug abuse can be in terms of using it for a purpose that it is not meant for, using it in quantities that is not expected, using it for a prolonged period of time that is not expected. Any of this is an abuse of medication.
All right, thank you, sir. So the next question is, what are the challenges or risks of abusing drugs?
Well, there are several challenges that are faced or that confronts people who abuse drugs, and even the society in general. In the first place, for the individual, they are likely to face complications in the use of drugs abnormally. A drug, for example, that is used to relieve pain, if one takes it because of the other side effects that are embedded in it, you are likely to use it either in larger quantities or use more frequently. And most drugs have their tolerance limit. They have their side effects. And when used in dosages not prescribed, the side effects are likely to be accentuated. And there are several side effects. There could be side effects on the psyche, that is, on the mentation of an individual, their consciousness levels, and their ability to coordinate. It can be an impact on the organs of the body. It can impair the kidney, for example. Drug abuse can also cause impact on the gastrointestinal system, that is the gut system of an individual, and so on and so forth. There are so many side effects that can occur with drugs when they are not used in the proper dosage and for the proper duration of time.
All right, sir. Thank you. So the next question is, has there been any cases of drug abuse on campus?
There are certainly many drug abuses, both conventional and unconventional. On the campus, most of the drugs that are abused are drugs that tend to have impact on the level of consciousness of an individual, drugs that are used to relieve pains, drugs that are used to create a high, a feeling of happiness. And even for some drug medications that are naturally for maybe for curing some ailments, especially antibiotics, are also subject to abuse. But the most common drugs of abuse are even some unconventional drugs at times, like alcohol, like drugs that are meant to create some calmness, drugs that make people drowsy, like Tutolin, called the cough syrup that we know. And some people even use some unconventional chemicals because they want to feel high, because they want to feel excited. Some people smoking gum. Some even go to the toilet at times and smoke the gas. They go to especially in pit latrines, go into such places to smoke. But on the campus, alcohol-related drug abuse had been an issue. Marijuana has been an issue. And then some unconventional medications have been abused. Also, we also know that there's, like I told you, people taking cough syrup, people taking, because when they take cough syrup, it makes them drowsy and it dulls their senses, helping them to escape from the challenges they think they are facing at the moment. Such have been documented, and it has been on for a long while, especially when examinations are drawing near and students have to undergo a series of either makeup tests or tests as it were. So in such situations, people look for an escape and do this. And if prolonged, it can give rise to a change in behavior. It is to this extent that the university has deemed it fit, I think in 2006, to institute an emotional clinic in this facility to address such issues to some extent, while also engaging the counseling unit and every other unit that needs to educate people to do something about it.
Okay, so almost getting into the question 4, because it's related to what you just said. What are the resources made available for students with cases of drug abuse?
There is a lot of resources that have been made available. Like I said earlier, we have had to collaborate with the teaching hospital in times past, largely. Cases that are identified are sent to the teaching hospital for management. But because of the logistics and to make it easier to decrease the man hours lost to students, a specialist clinic for emotional problems, including drug abuse, was instituted at the University Health Center. And to that extent, we run clinics on Tuesdays and Thursdays. And a lot has been done in this direction. This is for treatment of cases and also for getting a groundwork for counseling and also liaising with a more technical health institution like the teaching hospital for the care of those that have been found to be involved in drug abuse. We have collaborated with centers all over the country where students who have been involved seriously in drug abuse go for rehabilitation. And we have softened the ground for them to ensure that they don't undergo too many difficulties in getting withdrawn from such medications. Oftentimes we involve the parents and we involve other caregivers, meaningful caregivers that can be a support system for them so that after the rehabilitation they are not likely to go back. So a lot has been involved in that. And we also liaise with the departments of such students so that they are not in any way adversely victimized, so that they can still continue in their career pursuit educationally.
Thank you, sir. The last question is, what advice do you have for students regarding this issue?
Let nobody think that they cannot be involved in drug abuse. When you know the danger of a problem, you are likely to be more cautious. Drug abuse is more than meets the eye. Many people abuse drugs in different ways, and some initially they don't know. Drug abuse can be as a result of peer pressure. It can be as a result of ill advice. Oh, I had headache, and you took paracetamol. It is not working, paracetamol extra. No, if you add this and that together, it will make it better for you. And then you get involved in a drug that has a tolerance level, and such an individual begin to take more and more of the medication. You are getting hooked to drugs. So oftentimes don't take a medication that is not prescribed as much as possible, except the off-counter medications like probably paracetamol, MMT, those basic drugs, maybe drugs to relieve catarrh. Apart from those off-the-counter drugs, don't take medication without the advice of the expert. And as much as possible, collaborate with people. The university in Ahmadu Bello University, as it were, has provided so much leverage to help people who are challenged. You are under stress and you go to the counseling center, the door is open there. Outside there, even the course coordinators at times can be people that students can confide in. If anybody comes with health-related issues here, we don't throw them out. As busy as we could be, we find a time to discuss with people and advise them accordingly. And I think that if people engage themselves in seeking opinion, health-related opinion, socially related opinion, either here or at the counseling center, most issues of drug abuse will be arrested. And in case a person finds out that they have already begun to abuse certain medications, it is not something to keep secret. Before the damage is done, it is good that an individual speak out. So speaking out is very important. If you speak out for help, if you don't shout for help, nobody knows that you are drowning. But as many as speak out, help is available. And the earlier a person avails these opportunities, the better for the individual.
Right. Thank you very much, sir. Thank you for this insight, and it's going to help a lot as we are going to tackle this and discuss it within ourselves and then put it out there for the students to learn from it also. Thank you so much, sir. Thank you so much for having us. Welcome back. That was really insightful from Dr. Alex. Now over to the panelists. Ms. Rabia, what's your take on why drug abuse is affecting students on campus?
I Okay, so thanks so much for having me. Okay, so why this is happening among youth, why drug abuse is happening among youth, we can see different factors. We can see private pressure. We can see instability from families and stuff, and maybe stress, academic stress. We can see academic stress because when we look at it, when it comes to exam period, you can see that students would want to read and read, because if you look at it, they didn't prepare early, and so when they are trying to read that day to finish the course, you see that they're having maybe headache or stuff. So you see some taking paracetamol, some can take 4, some can take 6 if possible in a day to relieve them from all this stress and physical.
Thank you so much. That was really insightful. Now over to our second guest, Miss Hanifa. How do you think drug abuse is affecting students around here?
Thank you so much. Drug abuse affects students seriously on campus. Academically, you'll see students draining. Academically, you hardly see students in class participating in the group discussions and other academic activities. Secondly, the relationship with students too. Drug abuse actually affects the relationship. You always see students who are taking substances always isolated. They are always alone. I do because of the substances they abuse. Then the third one is actually mental health. It affects them.
Thank you, Miss Hanifa. That's a very good observation, and it is true. Those that abuse drug are mostly seen isolated because they do not want to mingle with others because of the effect the drug has on them. Thank you so much. Now over to our third guest, Miss Zuwaira. Miss Zuwaira, how do you think we can tackle the issue of drug abuse on campus among students?
Thank you for having me. Ways that we can use in tackling the issue of drug abuse on campus through providing counseling service. Many students engage in drug abuse due to stress, anxiety, and also peer pressure or any other emotional challenges. So through providing counseling service, students can be advised on how to manage stress, anxiety, and also avoiding bad companies. And another way in tackling drug abuse on the campus is through creating awareness about the effect of drug abuse on students. When students are aware about the risk of drug abuse, such as on their mental and physical health, and also academic performance, as well as their relationship and future opportunity, they'll make the right decision concerning engaging in drug abuse. And the last part is the university should also provide a guidelines regarding drug abuse by setting policies that actually on policies on the possession of drugs, drug use, and also distribution, and also outlining the consequences relating to such behavior.
We've heard from our panelists. They've given their own individual contribution, which will go a long way in sharing insights on how to go about this drug abuse issue. Now over to our audiences. Thank you so much for coming and sharing great insights regarding this issue of drug abuse. Thank you. Listeners, thank you for your time. And we also have our audiences here, and we would like to take 1 or 2 questions from them.
Thank you so much, Ms. Zuwaira. What you have said, it's really impactful. So I would like to ask question on how can we manage stress among students on campus, especially during exam period?
Thank you so much. That's a great question. Ms. Zuwaira, can you...
Issue of managing stress during exam period on campus, especially during exam period. You know, this is the time that most students are kind of stressed and kind of more engaged in terms of reading. So if you feel like you are kind of stressed out, you can take a break. Like, you manage your time on time you read and also the time that you use to rest, you understand, and make sure that you engage in healthy habits like exercise in the morning. You can do this yoga, and you can also probably seek for advice from any medical center. I think that's the best way to manage your stress. And don't overstress yourself. Make sure that you manage your time properly. Take good care of yourself as you are reading and as you are preparing for exam. And that will also improve your performance during exam. Thank you.
Thank you so much, Ms. Rabia. My question here is, how can you personally advise a student that is already involved in drugs, that is afraid to speak out or quit?
Okay, there are many ways, but I would personally mention three, which you can actually try and get to quit or stop this drug abuse. One, you have to be determined, because you can't just say you want to quit and you are not determined to stop what you are doing or quit taking drugs. Then then two, counseling. You meet someone. This is where you actually meet someone that you feel you are free, or you can confide in. You can say your problem, or you feel you want to stop, then you would explain, talk about the challenges you face the challenges you face. Then the third one, that's there are many centers. Your lifestyle, because when you are determined, that is when you would want to change your lifestyle and look at the things that, okay, what do you think you can do to stop? Like, what are the things that actually triggers you? Or is it the environment? Is it influence? Is it peer pressure? Like, there are many or different factors that actually makes you take or want to continue. But once you focus your mind that, okay, you want to stop, then you just buy.
Thank you so much, our panelists. It's been an insightful moment. But my question goes to Ms. Hanifa. Please, could you shed more light on indicators or ways that we could easily identify people who are abusing drugs?
Thank you for the question. Like I said earlier, you always see them isolated, stressed, their way of dressing. Sometimes they can be aggressive too, their lips and also their eyes too.
Okay, we are out of time, but this has been an amazing discussion. Huge thanks to Dr. Alex Otu for his insights, our panelists and audiences. To all students, let's support each other and help and reach out to the school sick bay when necessary. And lastly, don't forget to say
no to drug abuse on campus.